inflammation. Overview. What is it? Chronic inflammation is long-lasting and involves the presence of mononuclear cells like macrophages, lymphocytes, plasma cells. This process causes tissue damage and repair at the same time, including new blood vessel growth, angiogenesis, and scarring, fibrosis. It often follows acute inflammation, but can start on its own. Main causes stimuli: persistent infections, e.g. tuberculosis, syphilis, some fungi, viruses; type 4 hypersensitivity, T-cell mediated; autoimmune diseases, e.g. lupus, rheumatoid arthritis; long exposure to toxins, e.g. silica; foreign bodies, e.g. surgical implants, splinters. Key cells and mediators. Macrophages are the main players. They interact with T cells to keep inflammation going. T cell roles. T1 cells release IFN gamma, activates macrophages to destroy pathogens, classical activation. Th2 cells release IL-4 and IL-13, promotes tissue repair and reduces inflammation, alternative activation. Possible outcomes: scarring, fibrosis, amyloidosis, abnormal protein deposits from chronic inflammation. Cancer, long-term inflammation can lead to tumors. Example: chronic hepatitis C, liver cancer; Helicobacter pylori infection, stomach cancer. USMLE style question 1. A 60-year-old man with a history of hepatitis C infection is found to have a liver mass. His liver biopsy shows chronic inflammation and fibrosis. Which of the following best explains this progression? A. Type 1 hypersensitivity reaction. B. Chronic macrophage and T-cell interaction. C. Neutrophil activation by IL-8. D. Formation of immune complexes. E. Acute response to bacterial infection. B. Chronic macrophage and T-cell interaction. Explanation. Chronic inflammation is driven by long-term activation of macrophages and T cells, especially in viral infections like hepatitis C. This interaction leads to fibrosis and increases the risk of cancer. Why not the others? A. Type 1 is immediate, e.g. allergies. C. Neutrophils are involved in acute, not chronic inflammation. D. Immune complex deposition is more typical of type 3 hypersensitivity. E. Acute responses involve neutrophils and short-term inflammation. How USMLE style question 2. Which of the following cytokines promotes the repair phase of macrophages during chronic inflammation? A. IFN gamma, B. IL-1, C. IL-8, D. IL-4E, TNF-alpha, correct answer. D. IL-4, explanation. IL-4 and IL-13 activates macrophages in the alternative pathway, promoting tissue repair and anti-inflammatory functions during chronic inflammation. Why not the others? A. IFN gamma activates macrophages for pathogen killing, pro-inflammatory. B. IL-1 is a general pro-inflammatory cytokine. C. IL-8 attracts neutrophils, acute inflammation. E. TNF-alpha promotes inflammation, but not tissue repair specifically.